Being a nurse can be a stressful job. It can cause real damage to both one's physical well-being and one's emotional and mental state. Despite looking after other people, many nurses will forget to look after themselves in the same way. It's vital that all nursing candidates have given thought to this aspect of the job and how to approach it. It has been found that nurses will suffer from more musculoskeletal problems than the public in general, have a higher risk of acquiring blood-borne infections and TB, and will have more occupational allergies. Some allergies have found a notably higher rate of depression in nurses than the general public. Additional studies have found issues such as sleep deficiency, lack of exercise, and increased risk of cardiovascular disease. Each of these is a very real issue for nurses themselves, but could also present an issue to their patients. An unwell nurse is unlikely to provide the same high standards of care that they might be able to provide were they healthy. Studies have found that nurses suffering from depression or musculoskeletal pain are more likely to report medication errors, more likely to have patients fall, and unable to provide as high quality of life to their patients. A healthy nurse should maintain their physical health, their mental health, and their emotional and spiritual well-being. They should be happy in their profession and happy in their personal life as well. In order to be healthy, nurses must be active in caring for themselves. They must take steps to ensure their own health rather than be reactive in dealing with issues. One way to be healthy as a nurse is to communicate with others and to communicate well. That means learning to communicate with your colleagues effectively and to communicate with patients just as effectively. You should be aware of the importance of conveying your problems to your colleagues, and good communication is vital for this. Good communication will rely on empathy, managing conflicts with others, and understanding when is the right time to speak to others about their issues or your own. You should be conscious of the way in which you use social media. Ideally, one should avoid becoming too reliant on social media, as it can both eat into one's time and often provide unrealistic images or goals. However, you should look to use apps for health promotion and apps that might help when you're on the wards or with your organisation. You also might find social media helpful for obtaining professional advice and for patient education. Make sure that you avoid posting anything that could be harmful to your professional life on social media, and avoid any inappropriate relationships with patients on social media. Both could be devastating to your career and thus your mental health. You should ensure that you focus on your physical health and well-being too. Many nurses are overweight. 50% of those in the US are either overweight or obese. Therefore, consider your diet and whether you are able to find healthy food at the hospital canteen or near your place of work. You should consider the lessons that you give to your patients and try and live as an example to them. Whilst it may sometimes be hard to find the time to exercise if you have a busy shift pattern, try to find the time to exercise in some form a few times a week. There might be a class that you can attend during your lunch break at work, for example. Remember that your sleep will impact your nutrition as well and could have effects on your weight and general health. Sleeping well goes hand in hand with mindfulness and finding ways to avoid stress that work for you. That could be exercise, meditation, or finding a group of others to join to discuss work stress and ways of dealing with it. How will you balance the amount of work you'll face as a nurse and as a nursing student with your personal life? How will you deal with the stress of working as a nurse? How will you stay healthy working as a nurse?